Altered Physiology Mechanisms of Disease 1, Week 7, Episode 7, our final episode on cancer. Up until this point, we've talked about abnormal cellular division and how cancer can invade other tissues. In this particular episode, we will look at the diagnosis and treatment and clinical manifestations related to a cancer diagnosis. Firstly, there are tumor cell markers or biological markers, which are actually produced by the cancer cells, and they can be found on or inside the tumor cells, in the blood, cerebrospinal fluid, or urine. These tumor markers are used to screen and identify individuals at high risk for cancer. They can diagnose specific types of tumors, and they can be used to observe the clinical course of cancer. A list of them has been provided on the screen. However, tumor markers alone are problematic. You could have false positives or false negatives, whereby an individual is incorrectly identified as either having cancer or perhaps not having cancer. Next, histological staining can be used to classify tumors. This may be useful in improving treatment. This can be supplemented by a more extensive genetic analysis of the tumor. Now let's take a look at cancer treatments. Surgery, radiation, chemotherapy, immunotherapies, and targeted disruption. I am sure that everybody has heard of a number of the different common cancer treatments. Let's take a look at each of them, starting with surgery. Surgery can be done to prevent cancer. So in the case of colon cancer, prior to the official diagnosis or development of colon cancer, individuals can have what we know as colon polyps. And these polyps are tissue that can be removed to prevent the cancerous growth. Surgery can also be done for the purpose of a biopsy. This can be useful in diagnosis and staging. Surgery can also be done to sample lymph nodes to see whether a cancer involves the lymph nodes and perhaps has spread. Palliative surgery can also be done as well in more or the later stages of cancer, I should say. Next, radiation. The goals of radiation are really to eliminate or eradicate cancer without excessive toxicity. It also tends to avoid damage to normal structures, and that would be a secondary goal. Radiation works by having ionizing radiation damage the cancer cell's DNA. Next, chemotherapy. Chemotherapy takes advantage of specific vulnerabilities in target cancer cells. It is usually given in combination with other treatments and designed to attack a cancer from many different weaknesses at the same time. There are several different types of chemotherapy, including induction chemotherapy, where it acts to shrink or eliminate the tumor. Immunotherapy involves the use of numerous potential therapeutic vaccinations. However, they have often proven unsuccessful. There is potential that vaccines could be used against oncogenic viruses to provide protection and prevent the onset of viral-induced tumors. One such example would be HPV. Lastly, in the case of targeted disruption, this is a highly specific process that is often used in combination with chemotherapy. Targeted disruption attempts to inactivate oncogenes, which are those mutant genes. It tends to try to block angiogenesis, or the formation of new blood vessels, which are obviously crucial in the spread of cancer or the metastasizing of cancerous cells. It can also be used to affect cell metabolism, induce apoptosis or program cellular death, and it can also be used to neutralize cytokines. Lastly, here are a number of different clinical manifestations associated with cancer and cancer treatment. Firstly, if we start off by looking at pain. In the early stages of malignancy, there is often little or no pain associated. However, pain may be influenced by fear, anxiety, sleep loss, fatigue, and overall physical deterioration. There are a number of underlying mechanisms which may be associated with pain. These include things like pressure, obstruction, invasion of sensitive structures, stretching of visceral surfaces, tissue destruction, and inflammation or infection. Fatigue tends to be the most reported symptom. This is a subjective clinical manifestation. This may be further associated with weakness, lack of energy, inability to concentrate, depression, sleepiness, and a lack of motivation. Other suggested causes may include sleep disturbance, biochemical changes that are secondary to the disease and the treatment, psychosocial factors, level of activity, nutritional status. Cachexia is a very severe form of malnutrition. It includes anorexia, weight loss, anemia, taste alterations, and altered metabolism. Anemia is another clinical manifestation, which refers to a decrease in the hemoglobin within the blood. The underlying mechanisms include chronic bleeding resulting in iron deficiency. It can also result from severe malnutrition, medical therapies, and malignancies in blood-forming organs. Leukopenia and thrombocytopenia occur with direct tumor invasion to the bone marrow. Certain chemotherapy medications may also be toxic to the bone marrow. Infection is another clinical manifestation, and the risk of infection tends to increase when the absolute neutrophil and lymphocyte counts fall within the human body. These are two types of your white blood cells, which are obviously crucial to your immune system function. GI manifestations or gastrointestinal tract issues may include malabsorption disorders, diarrhea, and therapy-induced nausea. Lastly, Hair and skin manifestations can include the loss of hair due to chemotherapy. However, this is usually temporary. In addition, skin can become dry and break down. These are a number of the different clinical manifestations that result with a cancer diagnosis. And that concludes this episode.